We're hearing a lot about weight loss injections right now. Well, Denver Regenerative Medicine is a local clinic, and they say they can help patients see up to 30% loss of weight. And here with more, owner of Denver Regenerative Medicine, Dr. Joel Cherdack, and patient Holly Anderson. Hello to the both of you.
Hi, Claudia.
Hi. Okay, well, doctor, I'll start with you. Explain how semaglutide works for weight loss here.
Well, first of all, thank you for having us on the show.
Of course.
By this point, almost everybody's heard of the drugs, Ozempic and Wegovy, and how well they've worked for people, either through social media, they've heard about it, or through their friends. It's out there. The active ingredient in these drugs is called semaglutide. And what semaglutide is, it's a drug that mimics the hormone that your body naturally produces to tell your body that you're full and that you don't need any more food. And so by taking this drug, what it does is it reduces cravings for food, and it tells your body that you don't need as much food as you did before. And as a result of you needing decreased food or feeling like you need decreased intake of food, you reduce the amount of food that you eat, you reduce your portion size, and as a result, of course, you lose weight.
Yes. Now, how do you help patients decide if this would be an effective and good way to lose that weight or reach that goal that they've been wanting to reach?
Well, what we do is our patient coordinator will first speak with any prospective patient, get a health history, a brief health history on them, go through all of their past weight loss attempts, and talk about their weight loss goals. And if it's a good match and patients feel like it's something that's going to be effective for them, then they'll speak with one of our medical doctors who'll go more in depth about their medical history, make sure that they're not going to have any negative effects from the drug, and make sure that they're going to have the result that they want, and also make sure that the dosage is going to be correct for those patients.
That's right. And doctor, it's worked for so many of your patients, including Holly, who we have here today. Share more about how you became interested in using semaglutide for weight loss, Holly. What was that journey like for you?
What got me to Dr. Joel is feeling uncomfortable in my skin, feeling tired of being uncomfortable. So I've heard a lot of the good things about semaglutide, and it ended up being in my price range. So talking to the doctors there, and they helped me decide that it was the perfect fit for me.
That's so wonderful to hear. Now, let's take a look at your before and after picture, Holly. Now, when did you start on this journey? Oh, well, you look beautiful in both, but there is a difference there. When did this first start for you?
I started the semaglutide in December. The weight just kept falling off. My goal was 165. I got to 165, I'd say after 3 months. 165 became 160, became 155, became 139 now. I've been keeping that weight steady, just wanting to keep it at 140, and just been able to keep it steady for 2 months now.
That's so good. Well, I'm so happy for you. And I think sustainability is another big thing when it comes to that weight loss. A lot of us will lose some weight, put it back on, and that's just kind of how it goes forever. How was it for you to administer the drug, and how often did you have to do it, Holly?
So it is a weekly injection.
Okay.
And needles are intimidating, sure. The first time was intimidating. The second time, it's like riding a bike, what they say. So you do it, and it's not intimidating probably after the first time, but it is weekly.
Okay.
And it's definitely something that people can do on their own at home.
Right, it's convenient too. Have your eating habits changed at all? What have you changed?
Oh, everything has changed. My eating habits have definitely changed. I'm one that overeats. I'm gluttony. I love to eat. I overeat. I eat from morning to noon to night. And so with this, I'm able to control my hunger. I don't eat as much. My portions are smaller. So it's been a great journey.
It really does sound like it. Well, doctor, this kind of treatment can be expensive for some people. How are you helping make it more affordable, and where do you get the medication here?
Well, as many people already know, the brand-named drugs, Ozempic and Wegovy, can cost patients upwards of more than $1,000 a month. Because there's a shortage of these drugs,
Yeah.
the FDA has allowed compounding pharmacies to make the same active compound, semaglutide, which we're talking about now. And so we utilize a few different compounding pharmacies. The way that we've screened our compounding pharmacies is by making sure that the products that they use to make the semaglutide come from FDA-approved facilities, and also that there's a third-party independent laboratory that tests every batch that they make for purity. So we know that it's safe, we know that the patients are going to get the right dosage, and we know that these are very good quality pharmacies that we're working with. And because it's not the branded drug, we're able to offer it at a significantly discounted price, at a price point that patients can really afford. Because for most people, $1,000 or more a month isn't even realistically within their price range. But with the offer that we're making, it's available to most people. It's something that most people can afford to do if it's something that they really want to do.
That is so good to hear. And Holly, so inspiring to see you go through that journey and reach your target weight so quickly. It really does say a lot. And thank you so much, doctor, for being with us this morning. And right now is a good time to start.
No better time than the present to start your weight loss journey.
That's right. Well, thank you both for being here this morning. And for you guys watching, for a very limited time, Dr. Cherdack at Denver Regenerative Medicine is offering semaglutide for $275 per month if you contact them before the end of July. This is an extreme discount that won't be available for long. So if you're curious about how it all works, the semaglutide, and if it can work for you, then call right now, 720-583-1648. You can also go and learn more online at denverregen.com, denverregen.com. Denver Regenerative Medicine sponsored today's segment.